And we're back now with a health alert. New research estimates about 1 million Americans a year could develop dementia by 2060. That's roughly double today's numbers. Our chief health editor, Dr. Partha Nandi, is here to tell us more about the findings. And Dr. Nandi, how do these current numbers compare to where we were, and why is it increasing?
First, it's great to see you again.
Oh, thanks,
It's awesome
man.
to see you. Missed you.
Thank you.
So listen, I hear from my patients all the time that dementia is one of the health issues that they fear the most, sometimes number one. And I always tell them that there are steps that they can take right now to lower their risk. Now, to answer your question, the earlier research estimated that 14% of men and 23% of women would develop dementia. But a new study published in Nature Medicine shows this, that after age 55, up to 42%, that's right, 42% of folks may face this condition if they live long enough. Now, researchers followed roughly 15,000 adults in the U.S. for several decades, and they found that the risk rises significantly with age. So between 55 and 75, the risk is 4%. By age 85, it jumps to 20%, and by 85 and 95, between those two ages, it climbs to 42%. However, some groups face higher risks than others. Women in particular are more affected than men, unfortunately, 48% versus 35%. And Black Americans, well, they have a 44% lifetime risk compared to 41% for white Americans. So, you ask, why are these numbers rising? Well, folks are living longer than past generations, especially women, which is why their risk is higher. Plus, more awareness and screening may also mean that more cases are being diagnosed.
So the study points out that dementia is not an inevitable part of aging. So,
I love that question, right? People
Right.
think, they're getting old, they should get dementia, but dementia happens when the memory, language, and thinking skills gradually decline, Glenda. So Alzheimer's disease is the most common type we think about, and brain changes leading to it can start silently. Get this, up to 20 years before symptoms appear. Other types like vascular dementia happen when heart disease or small strokes reduce blood flow to the brain. Now here's the good news, right? Research shows that what you can do in midlife can make a significant difference. So here's some simple steps to lower your risk. Number one, manage conditions that are chronic. Keep high blood pressure, diabetes, cholesterol under control to protect your blood flow to the brain. Also prioritize sleep. I got to take that advice, right? Treat sleep apnea. Aim for 7 to 8 hours of sleep every day. Stay active. Regular exercise is super important to keep both your heart and your brain healthy. Eat well. A diet healthy with fruits and veggies and whole grains supports brain function. And stay connected and engaged. Please spend time with others and challenge your brain with things like hobbies and learning. Protect yourself also. Wear helmets to avoid head injuries and consider hearing aids if needed to prevent isolation. The key window, right, to protect brain health is between the ages of 55 and 75. But hey, it's never too early or too late to start. The sooner you put your health first, in my opinion, the better your chances are of reducing your risk. And you asked the critical question, is this inevitable? And it's not. People can live to their 80s and 90s and have great mental health, and that's what we aim for.
All right. Thank you, Doc. Those are great pointers.
My pleasure.
All right. Thank you so much. If you have a health question for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or X. We'll get it right to him.